It's been nearly 3 years since the WHO declared COVID-19 a global emergency. And the UN Health Body Chief says the pandemic will still keep its status. Despite calling for continued vigilance, Dr. Tedros says he's hopeful that the world will transition out of the emergency phase of the pandemic this year. Our Seung-jae has more.
After almost 3 years of the COVID-19 pandemic, the World Health Organization Director General Dr. Tedros Adhanom Ghebreyesus said Monday that COVID-19 remains a global health emergency.
The committee has advised me that, in its view, COVID-19 remains a global health emergency, and I agree. As we enter the 4th year of the pandemic, there is no doubt we're in a far better situation now than we were a year ago, when the Omicron wave was at its peak.
The comments came as a WHO's emergency committee met last Friday and advised Tedros that the virus remains a public health emergency of international concern, the UN agency's highest alert level. The decision also comes as the U.S. earlier this month extended its public health emergency until April. The WHO chief also noted that the world is in a far better place than it was a year ago when the Omicron variant first swept the globe, adding that at least 90% of the world's population has some level of immunity to COVID-19 due to vaccination or infection. However, he stressed the need for continued vigilance as the latest reports show that the numbers still remain a concern globally.
But since the beginning of December, weekly reported deaths have been rising. In the past 8 weeks, more than 170,000 people have lost their lives to COVID-19. And that's just the reported deaths. We know the actual number is much higher.
Dr. Tedros last month said he was hopeful that the world will transition out of the emergency phase of the pandemic this year, which would mean hospitalizations and deaths have dropped to the lowest possible level, and health systems are able to manage COVID-19 in an integrated and sustainable way. Seung-jae, Arirang News.